Hello, everybody, and welcome to another edition to the Think Oral Health podcast. We are fresh off the HLTH conference experience. This is our first episode recording, not in Vegas and not on the health floor. Equally excited and at an equally momentous occasion, if you will. This is Thanksgiving week, and we have a lot to be thankful for. I am personally very thankful for the year-long partnership with Dr. Jonathan Levine and what we've been able to create together. I'm also very thankful that we've got two amazing guests today talking about a very important topic to all of us. So welcome, everyone. And hello again, Dr. Jonathan Levine. Could you please tell us who are we having a conversation with today?
Yes, thank you, Maria. And I have to tell you, it is Thanksgiving. And yes, I am tremendously grateful for our partnership. We've had a lot of fun this year and we're just getting going. But to talk a little bit about today's episode, we have two very special people, Dr. Tina Saw and Brian Jones. Tina is a DDS. She's a dentista, as they say in Italy. She's the CEO of a brand new company. That is amazing. That's really talking about and really going to show the world how Salivary Diagnostics is the new blood diagnostics. The company is called Oral Genome. She's also a board member of Harmony Health. Well, you know, as a dentist and a mom to a child with autism, she knows firsthand the struggle that IDD patients face. And that's one of the drivers why she invented the first ever chairside salivary test. So we're going to dive into that. Brian Jones is the Chief Growth Officer for Avisis, a dental and vision specialty benefits provider. Brian heads initiatives that enhance healthcare access, the outcomes for both Medicaid, Medicare, and other populations with special healthcare needs. He also serves on the board of directors for Team Smile, a not-for-profit organization provides children in need with a life-changing dental experience through the power of sports, near and dear to my heart and all of our hearts. Well, let's kick it off, Maria.
Thank you for this introduction, and what an impressive lineup of accomplishments you both bring to the table. Both Jonathan and I like to talk about the fact that impact and entrepreneurship is not for the light of heart or faint of heart or those who try to follow a traditional path. Both of you seem to have a fairly non-traditional way of arriving where you are today in your impressive careers. Could we just kick it off by you telling us your personal why and what drove you and gave you that purpose to get to where you are now, and why are you doing what you're doing? Tina, let's start with you. I'm curious.
I mean, my personal why is, dentistry, it's such an old profession. Like, it's been out there for a long time. I think it's like the ancient Egyptians were like the first, don't quote me on that, to start dentistry. And they were even doing things like—
It's actually Paul Revere in Boston, who used to be the cobbler and was also the local town dentist. So that's what I know, but probably before him too. Yes.
Yeah. And so, for me, it's always looking for ways. I was a private practice dentist for a really long time, worked for a DSO, worked for federal qualified health centers, lots of community clinics. And there were these problems that would just like itch inside me. I was like, why hasn't someone come up with a better solution? And it's not stuff that you can Google. And when we talk about innovating and thinking like how we can improve things, that's really important. And I think you have to be really bold and gutsy and just really push those like boundaries no matter what. And even if people say, hey, you're a little bit crazy and you're like, you can't do, somehow we're still here. And here we now I have this company, Oral Genome. We do point of care salivary diagnostics, and nobody has really done something to the level of what we've done with so many biomarkers. So, I guess my story is like, hey, I don't like to take, I just like to push forward, and I don't like to have no as an answer. Like, I'm going to do whatever it is. Let's find a solution and let's like brainstorm to make things happen.
It's amazing. I have a feeling we all share that. We don't take no for an answer. Brian, what brought you to where you are now?
Boy, it's been a journey. I started my career over 20 years ago in the defense and diplomacy sector. Focused on a lot of international work. But I think that really drove me to understanding and how I want to work with um, really diverse populations, especially those that while I was working in underserved countries, really drove my passion to work in underserved communities. Which when then I got exposed to some of the inequities in the health space through personal experiences with my father going through very advanced cancer treatments, and then the aftermath of what happens after somebody passes with that, and the maze that you have to go through to get anything done in the healthcare space. I really drove it as a personal mission to say, how can I get into this space, streamline the processes that are there, but also from an outcomes perspective, introduce new ways where the patient experience, the provider experience, the family experience within that is much more comprehensive and easier to understand. And that's for in my role now, it's really how I've advanced our solutions as an organization to say, how are we focused on the stakeholder experience and not so much the individual claim. The claim will happen, but how do we build all of those infrastructures around it and personalize the care that much better?
Amazing. And for our listeners, what brought you, the two of you, together? I mean, clearly very distinct individual paths, but what are you working on together that brought the two of you on that same mission, vision podcast, if you will?
Sure. I'll start. When you look at just the Medicaid population in general, there's a very small portion of the population that makes up a vast majority of the cost in the sector, and that's individuals with developmental disabilities, seniors, and other special healthcare needs populations. And we at Avisus decided that that's the sector that we're going to tackle. A vast majority of our competitors in the space can handle the 80% of the Medicaid population fairly easily, but nobody's really taken on the hardest to serve that take up, a lot of the expenditure and a lot of the time within that sector. And when we started looking for technological solutions and other things that could help drive us there, it drove us to saying, how can we put more power in the hands of the members and the providers to build a collaborative relationship there? And that really drove us to seeking out salivary screening as a core solution to that. And through a mutual colleague, Tina and I got connected together, and we started working on really what's now becoming the core of value-based solution that we're driving at Avisus.
It's amazing.
It's so cool to see relationships working. So let me ask you, Brian, this question first. Value-based solution here, and you connected with Tina in that great story. Where do you see this going? The notion of point of care, and as a clinician, the importance of getting that information and screening with efficiency and effectiveness. Where can this go? Paint the picture for the future for us.
Sure. Well, at first we started with the traditional methods of evaluating oral health risk are antiquated. Right. You have three levels that are based on really observable fact and not real science-based fact. You can understand what's going on in a person's mouth by looking at it, gauging the inflammation, looking at tooth decay, cavities, etc. But really, when you look at it, you're continuing to chase the problem. You put an intervention, you come back 6 months later, did that intervention work? Yes or no? Try something new. And, we were finding that if we could find something to where we got proactive instead of reactive to what's going on in the dental chair at that time, we can not only offer better recommendations to those members for what happens in between visits, but also provide the providers a greater tool to educate the member on additional things that they can be doing, products that they could be implementing into their oral hygiene campaign, nutritional counseling, things like that. And so not only did we find it as a way that we could enhance the relationship between the member and provider, but also set them up long-term for things that they're doing in between visits. And then the value added benefit to that for the providers is we're giving them extra potential revenue streams to be able to add on additional services like those nutritional counseling, like additional things like that, which overall help them, make Medicaid and other programs like that kind of more palatable to the business models that they're operating in.
Could
This
you
is so
maybe
powerful.
give us an example of that though? Because there's a lot of revenue streams in those jargons. Not doctors in the room. What does that
Sure.
look like for a diabetic patient on Medicaid?
Oh, that's diabetic patients are the perfect example from that perspective. So let's focus on one scenario. So say we're in a rural population where there's not a lot of health infrastructure around, and the one point of care that they go to annually or twice a year is the dentist. Well, if we can implement salivary screening in that rural practice, or maybe it's an integrated rural practice where there's actually dental and medical happening in the same facility, we can identify core attributes through the saliva using salival glucose, things like that, to say, you might be indicating towards pre-diabetic or diabetic when they might not know that. And, then validate that, with an A1C test down the hallway to actually, look and see, where that is. But, as you work your way through that continuum, the integration of care, how we focus on wellness from that perspective, the systemic disease that's happening in the mouth, or just looking at things as simple as, the pH of the mouth or different biomarkers that Tina will get much more deeply into, really can lead us into a much broader look at systemic issues related to other comorbidities of health, whether it's diabetes, whether it's chronic heart disease, whether it's rheumatoid arthritis. There are pre-indicators in the saliva that help us look deeper that can then work as an integration between oral health care and overall health care from an overall wellness perspective.
So powerful. I want to make a point of what so many of us are talking about, which is the tip of the spear diagnostics in all of healthcare that can happen through dentistry. And that's what this powerful collaboration between you and Tina is showing. And so a question, I just want to toss it back to Tina, is the relationship, Brian, that she's had with you, this collaboration, and for the entrepreneurs listening, to really look at how the power of collaboration can drive development, because you start somewhere, but it iterates and evolves because of these powerful joint efforts and seeing what the marketplace really needs and feedback loops from this kind of partnership. So, Tina, the question to you is, how has this relationship helped drive some of the decisions you made along the way on the product development of what the offering was?
I would say, it's driven a lot of our decisions internally. And my perspective as a dentist and our team we kind of see problems that we want to get addressed. But we have that technology for like groups like Avises who say, hey, here's the problem that we have. How do we want to get members healthier? How do we want to help our dentists also grow their practices and have society healthier in general, make the state happy, all of that stuff. We took a lot of what Brian and his team kind of found out on things that needed to be done, implemented, okay, how can we fix that? How can we utilize oral genome to be able to tackle these problems and give something that's more objective? For us, we can talk all about oral systemic health till we're blue in the face. We talk about it all the time, literature, but for us, it's like, how do we wanted to develop an objective tool. Then we wanted to be able to pull even a report of, hey, this zip code of people who are males over 50 have a higher risk of caries. And we're finding maybe it's because this is a hot topic. There's no fluoridation in the water in this zip code or whatever it is. And so we're trying to be able to utilize our tests and deliver this data and the results to be able to target interventions. And we take a lot of the feedback from Brian and his team at Avises and be like, okay, what next can we do?
Right. Awareness, alignment, and then action. That's what you guys are doing together. And it's just such a powerful message to people building companies, because I look at what Oral Genome is doing and really the hockey stick growth that, from what I understand, that's about to happen. That only happens, we like to say that, life is a team sport, and so is everything else we do in our life. And I just want to highlight that to both of you, because it's really a special story for people to hear. So, Brian, getting back to you. So tell us a little bit, about that back and forth that you and Tina have had in this iterative process. And for you, how do you get that feedback back to her and vice versa, kind of in that reinforcing loop to get to a point where you had something really to test. And then you started talking to the oral genome as a screening device to then be able to take it to the next level of depth of understanding of unpacking the potential disease. Take us through that a little bit.
Sure. When we started exploring kind of what these solutions might look like, I think corporately there was some natural skepticism. It's a new technology proven by science, but not by practice yet. And so, what we really focused on with Tina and started funding was, let's put in place some pilot programs in some areas where oral healthcare is traditionally very bad. Rural populations. We've got pilots going on in Appalachia right now. We've got some pilots going on in some other places, really trying to discover, going to the hardest hit areas and saying, what impact can we have in the near term? And when I was looking at it from a solution perspective, it needed to be more than just a single test if we were going to really expand this and understand all of the elements that could be impacted by it. So it needed to have more than one biomarker. It needed to be accessible to a broad-based number of dentists. I could not ask dentists to spend, $2,000 on an expensive piece of equipment to test one thing. It needed to have an AI backbone so that when we're looking at it, we can actually provide good intelligence to the members. And as we started implementing the pilots, one of the side benefits was we were finding offices that were using the tool were actually becoming more efficient. They could find more chair time during the day because they were using this tool as a source of information to be able to streamline the processes they were working with their members on, not only recommendations that they were offering, streamlining the process of actually doing some of the other more traditional kind of oral health screening methods. We gave them an opportunity and a way to streamline that process. And so those were really a lot of the elements that we were looking at. And now we're ready to take that even broader and expand out those populations that we're serving there.
How long ago did you guys start the pilots? This is impressive, by the way. Congratulations.
Yeah. We wish we would have started them much sooner than we did. But we've been working on pilots really since the end of last year is when we started putting those in. And the example I provided earlier with the rural population, Oral Genome and Harmony Health just released a paper on some of the initial results of the salivary screening tools that we were using in rural West Virginia. Looking at what impacts those could have. And so we've really been focused this year on proving out those pilots.
Yeah. Could you maybe hit the highlights for us? Because I love the entrepreneurial journey, but I keep going back to that comorbid diabetic who lives in a dental desert, who can't really afford to drive the extra 2 hours to go see a specialist, and who can afford barely, fast food and has, a certain income. And so for that patient, what can we do with your technology, and how does the technology and the oral screening and diagnostic change the course of treatment for that patient and or the cost of care as well? So give us some of those highlights of that's what I was asking. It sounds like you have 1 year worth of data, or at least 6 months worth of data. That's hopefully enough to give us some trends.
So we started on the pilots in West Virginia, really in the dental office. We picked federally qualified health centers that had a medical office just right next door. So they were already in there getting their dental screening. And when we had figured out through the app that it was flagging that they were at a higher risk and possibly having diabetes, we were able to utilize the medical center right next door to be able to walk them over and then actually go and confirm a diagnosis of diabetes or pre-diabetes. When you start treatment earlier, it's less expensive for our system. And so for the people that we were able to do that, we did a pilot, I believe it was 79 patients, and we saved $118,000 just in that amount of people, just by integrating medical, dental, getting them next door to get these early care. Now, I understand a lot of times, like you're saying, like food is something that's really important. Like, fast food is not the healthiest, but there's recommendations besides that, you know,
Diet.
besides like the quick food that we have, the diet that is really, really critical, that is very cost effective, that you can do, that can really, really impact, and even different ways of your lifestyle that can actually really impact your overall health in general. So for us, it's like, how do we educate these members? How do we get them to do it all in a cost effective way to really help everybody in the system long-term wise in terms of reducing cost?
Yeah, a
Yeah.
lot of it is around building awareness and educating, right? And getting that wellness thinking going and not waiting till disease is going to form the sickness model that we all talk about, and just taking it in that direction. For the first time, look, as a clinician, to have it point of care, just that is a game changer when you have multiple biomarkers that you're looking at. So if you just take diabetes and you say to yourself, what happens when we get early on diabetes? What happens when we get early on systemic inflammatory diseases, which is going to happen by diagnosing periodontal disease, because we all understand what happens with chronic inflammation in the mouth and the connectivity to the rest of the body. The numbers are gonna be staggering once this gets into the marketplace. So let's talk
Yeah.
about that for a second. How far along are you at getting into the marketplace? Tell us exactly what's going on and what's going to happen in 25 if you had a great crystal ball together and say, let's go. Who's taking it?
I'll go first. So we are in the process of aligning this solution to a state-based Medicaid program to be announced hopefully here in the very near future, where this is the core to, as I'd mentioned earlier, kind of our value-based system, bundling together the salivary screening and salivary diagnostics in a preventive model that offers incentives to providers to help us get members healthier. I think the other element, that we haven't talked or have talked around a little bit is a lot of the savings and a lot of the cost reductions, or however you want to look at it, happen on the medical side because of what we're screening for and what we can help prevent. And so one of the core elements of our solution is how do we surround that with community health coordinators and care navigators to make sure that the information that we're getting doesn't stop at the dental office. It works its way over to the medical offices, through the Medicaid health plans, through other care collaboration, through community health networks where we're already building trust with those members. And so how are we really expanding out not to just be a dental carrier? I hate being pigeonholed into being a dental carrier. We're an oral healthcare company. We fit within the entire system, and that's the spectrum that we want to live in. And so, 2025 is taking it and scaling it thousandfold for how we're doing this. And, we focused on the limited piloting up front to really make the case and show how it can be applicable. And we're finding that no matter where you implement it, rural, suburban, urban, frontier, there's a value that far expands what we had originally, I think, thought of where it could go, especially in the Medicaid environments.
Yeah.
And Brent, for the business model side of it, are you looking to, from a business case perspective, are you looking to see return on improved quality of outcomes or reduced cost? As a business leader, why is the VCs doing this?
So all of the above. There are avenues where an outcomes-based model is very much supported by this, and that's where we lean in. We know if we improve outcomes, we reduce cost over time. And so, implementing these strategies says, we're going to make people healthier through this technology. Therefore, we're not going to have to pay for as much perio down the road. We're not going to have to pay for as many cavities. There's going to be less crowns. There's going to be less everything across the board. And there will always be, those avenues that you can go down. And, why we're so keen on this is if we can really intervene and have an impact when they're not in the dental chair. So how are those recommendations for oral hygiene happening in between visits? We're going to have a much more monumental impact on that. So how are we integrating that into the community through not only formal channels like community health departments or departments of health, but proliferating that through non-traditional Medicaid dentists who might see this now as an avenue to start seeing more patients. Therefore, especially in states where the dental workforce has not yet come back yet, or there's still extreme hazards in that, we're introducing new practitioners into Medicaid because now we've made it affordable for them, or we've made it a revenue stream that can actually work with them in their office practices as well.
Do you see a future where the physicians would initialize this test, which would show the reciprocity of that back and forth testing where dentistry starts to understand the medical side and vice versa? Is that possible?
I think yes. And that's why we first started this in integrated dental and medical clinics, so that we could validate the efficacy of what's showing up in the saliva with what's showing up in the blood, or other avenues. And so I think thinking of it more broadly as a wellness device versus a salivary screening point of care dental test is where this ultimately goes. It is looking at things much more broader than just, again, one biomarker. We're trying to figure out how it affects everything systemically.
What's in store in 2025 for you, Tina?
I mean, I think that I'm going to echo with Brian. What happened in 2024 for us is when we started piloting, it was a very scary time. I was like, okay, how's this going to go for us? And we got the technology down, we got everything we needed. And so for us, 2025, and it's all happening right now, we're prepping the ways to really work on scaling up, getting more and more integrations in, and kind of like, okay, what else is next? I'm always thinking, I don't ever want to drop our test into just people's hands and being like, okay, here's the report. This is what you need to do. We're always, okay, do we need to bring in this technology? Do we need to do this, so that we have a more comprehensive care system? Also on the oral genome side, we're excited that we're working with so many dental offices. We're looking to expand all of that. We're working with some really large dental groups, even also some on the medical side too. And so for me, particularly the medical is very exciting because that opens the way, because they're already being like, we do see patients who have oral health issues, and they're utilizing our technology to be able to actually, physicians just as much as dentists want to bridge that gap.
Yeah, it's amazing. I mean, that's really the prospect of integrated care. And I love that we have a payer at the table and data-driven approach to collecting the data, capturing the data, and longitudinally tracking both outcomes and cost. So thank you for all that you're doing, acknowledging that this is just the beginning, and extending an open invitation for you to come back when the data is even more compelling and when you've had even longer time to run this program, not only as a pilot.
Brian, I have a quick question for you. So as you are looking to scale this, and I learned this from our own Glow Good Foundation missions, where we had medical and dental professionals under one roof, and then we tested this idea in a 4-service business model, and it's working magnificently, how medicine and dentistry can work together. How do you see the scaling, not only to level the playing field on the equality of care, but also for patients in urban, suburban, all these different areas in the different dental practices? How do you see that feedback, that screening tool working for the patients, the dental population, and the connectivity of dentistry and medicine, and the elevation of the two disciplines together for better patient outcomes?
Sure. No, I think there's the connection. Everybody says that the mouth is connected to the body. That's I'm sick of hearing it. And I said, let's start doing it. Let's figure out how we connect the two. And this is where oral genome really came in to say, this is how we're connecting the two. And so, the way we're really focusing on putting those two together, not only through integrated clinics, but through the care coordination and other elements, is the AI backdrop that follows this, that offers the recommendations on this, can look at, the entire, what's going on in the entire microbiome of the mouth, and saying, how are decisions that you're making on an everyday basis impacting your oral health, which then impact your overall health. And so recommendations on, maybe fluoride toothpaste not being the best solution for you because you have a very basic diet, and you should do an arginine-based toothpaste and mouth rinse. That changes the entire dynamic of what we call that between visit time. Different recommendations on toothbrushes, recommendations on diet, simple little lifestyle changes that can have a huge and monumental impact, because a lot of times what's going on in the mouth is then coming up from the body. And so, it's really giving you a broader lens on how simple changes related to not only your oral health, but how you introduce things to your body through chewing, swallowing, etc., can have a monumental impact to your overall health there as well.
Yeah, it's so good. Maria, what do you think?
Yeah. I think that the proof is in the business model and in the payment structure. The proof is in the payment model. And I'm very happy to see a pair clinical outcomes in cost. I think it's easier to do it in a Medicaid environment where there's risk-bearing contracts. It's harder to do in a fees-for-service environment. But you know me, I'm an optimist. So I think we need more pilots like this to generate the proof points.
Yeah.
So very excited.
I'm an optimist right
guys for
there
all you
with
do.
you. I'm an optimist right there with you. All right.
Yeah.
Thank you so much.
Thank you.
Thank you.